Welcome to You Can Get With This or You Can Get With That. That is a reference to Black Sheep song. Probably no one got but me. But yeah, so tonight you can get with this, you can get with that, selecting the right oil appliances for the right patients. We are thrilled to have a very accomplished, very experienced panel with us tonight. So let's take a moment to introduce each of them, although none of them really require an introduction. Dr. Kent Smith is the owner of Star Sleep and Wellness. Almost every dentist practicing dental sleep today has attended a course, a lecture presented by him, learned from him or at a roundtable, whatever it might be. He is a legend in real life. He's here. Dr. Kent Smith, what do you want to add to that?
Nothing. I was just, no, let's move on.
And then next, we've got joining us for the first time on one of our webinars, Dr. Srujal Shah, all the way from California. Dr. Shah is he's got multiple practices dedicated to oral appliance therapy, dental sleep medicine, and unlike Dr. Smith, who is a stalwart fan of all Texas teams, Dr. Shah is a fan of the Bay Area team. So, Dr. Shah, what do you want to tell us about why you're here and what you're going to share tonight?
I'm just excited. I think, when you said that Kent would be joining, I just said, all right, well, I guess I have to be there and hopefully learn a thing or two. So I'm just excited to join all of you guys.
Wonderful. Well, thanks for being here. And then sharing my initials namesake, Dr. John Tucker, JT from Pittsburgh. So we've got all three time zones represented. Actually, I guess all four. I'm in Arizona. So all four time zones represented here. Hey,
What's
Dr.
up, JT?
Tucker, great to see you.
Good to
Appreciate
see
you
you too,
being
brother.
here.
Thanks
Do
for
me
the
a favor.
opportunity.
Yeah, JT, do me a favor. Tell us briefly a little bit about Tucker Educational Excellence. What is that? What do you got going on there?
Tucker Educational Excellence does a lot of education, just like Kent. I met Kent early in my career in the dental sleep space and learned a tremendous amount from him. And just with Tucker Educational Excellence, I've tried to carry that mantra of learning and providing hands-on and evidence-based information for practitioners so that they're successful in managing their patients with a sleep-related breathing disorder.
Excellent. Well, you'll be able to certainly tap into some of that and share it openly and freely with everybody tonight. So
100%,
thanks
100%.
to each of you for being here. Looking at this panel, seriously, it's like we've got three of the top contenders for the dental sleep Mount Rushmore. So this is really a treat to have you guys here. Before we dive in, a couple of housekeeping things. Down at the bottom of your screen, you've got a chat feature. You can type your questions in there as we go. We're looking for any questions you want to get answered, any pushback you want to give, things you want us to touch more on, please type that down at the bottom. Elias is in the background there. He's the one corresponding with you when you type those questions, but we'll try to get those questions woven into tonight's discussion. If you stay on until the webinar's conclusion, which will be an hour from now, you will receive your CE certificate via email in the next 48 hours. That means don't email me tomorrow morning asking for your CE certificate. You will get it in the next 48 hours. If you don't have it in the next 48 hours, so that would be Thursday evening, check your spam folder. If you still don't have it, then please give me a shout. Something is wrong, and we'll confirm that you were here and get you a CE certificate. And then most importantly, please take action on what you learned tonight. Don't let this be, sort of an exercise in intellectualism. take what you learned tonight and act. All right. That's what we're here for. Thank you all for being here. Your commitment to your patients, to the field of dental sleep medicine, to your practice is truly laudable. That goes for our panelists as well as all of you attendees. So thank you. With that said, let's dive in. There is sort of a cliche that the best appliance is the one that the patient will wear every night. True, fair enough. With that being said, each one of you in your individual practices is a workhorse or two, devices that you use more than others. If we were to look at your monthly lab statement, there would be a device or two that you use more than others. So I'm going to ask, let's start with you, Kent, if you don't mind. What are the couple devices that you use most often and why?
Boy, you had to ask me that question, right? Good grief. Well, I mean, Prosomnus is the most common one in our practice. It's sort of the go-to appliance, and primarily because of their customer service, the culture of the company. We have excellent representation there who will answer any question that we have. They'll get back with us. So that's, they've won our allegiance for that reason. But we do 5, 6, 7 other type of appliances depending on the patient. Like you said, I think one of the lead up to this meeting is that there's not one appliance that works for everyone, and that's very true. There's not one style. Obviously, insurance dictates things, and but I would say all the other ones we use about to the same degree. I don't have really a number two at this point. Who knows? In 2026, maybe I'll answer it differently.
Got it. What about yourself, Dr. Shah? You use multiple devices, I'm sure, but there's one or two that you use more than others. What would those be and why?
Yeah, I've been I typically favor devices that have a soft liner. So I've made a lot of ProSomnus devices as well, and certainly like them. But more recently, I've been leaning on SomnoMed devices, the Herbst Advance or Herbst Elite. I like a lot. A lot of that is insurance driven with PDAC or Medicare CMS requirements. So I've been doing that. Their Fusion is certainly a great device as well. And then interestingly, we've had a lot of success with the EMA 3D. So it's we've now brought an entire 3D printing workflow into our office where we're printing these devices that are extremely minimal in size, durable, flexible. It's quite amazing actually. And surprisingly, our a device that looks like an EMA, like a Meyerson EMA, but is even slimmer and stronger. And so it's not FDA approved, so we don't use it for patients who utilize insurance, but it's certainly a great device for patients who are looking to self-pay for something. Like we treat a lot of VIP patients or others who are willing to just pay anything and get something that is absolutely the most comfortable as possible. And that device literally checks off most boxes.
And with that workflow, I mean, do they leave with the device same day?
They can but we usually are able to get it to them in 2 or 3 days, something like that. Just to give our staff enough time to print it, polish it, and all that kind of stuff. So.
And what about because I've talked with Sonny Bacala and Jameson Spencer about
Lux
that
Creo, yeah.
process. Yeah. But I mean, just tell me a little bit about kind of the learning curve with that workflow.
I certainly don't print the devices myself. And I'm fortunate that we have already in our office an assistant, a staff member who was very fond of 3D printing. And so we were able to take him from doing his 3D printing at home to do it in the office for us. He's very passionate about it, and he's doing a great job. I mean, in terms of acclimating to it, it took a few months, like 3, 4 months, to really get it to where now we know exactly what to do, and it just fits perfectly every time. And in the beginning, we had some more adjustments and things that we than we would have liked, but now we've been really happy with it.
Got it. JT,
Yes, sir.
what are the one or two go-tos for you?
I like appliances that are sloppy.
I don't know what that means.
So I will I will define that. Not slop and fit. I mean appliances that allow the mandible to pretty much go in any direction it wants to go, especially lateral excursions and protrusive. Obviously not posteriorly. So my workhorse is a Herbst design. I'm a big fan of Jim Adiago out in California. The Dream Systems, that's my go-to workhorse. I like the thermoplastic material. That's what I personally wear. So I have to stick with FDA cleared devices because I am 100% insurance driven. Something that I discussed quite a while ago with my dear friend Randy Kern from Pristine, and the positive benefits of doing that and the explosion that's happened in my practice. Another one is the EMA, and I will definitely use that for someone that's like a petite female that has no parafunctional habits. So those are my pretty much my big two go-tos,
Mhm.
so that I can stay within that FDA cleared, PDAC approved device for insurance.
Got it. And we've got some questions coming through already. One of them is about one of the newer devices here in the US, the Avera. And you're nodding affirmatively. You've got some experience with it. What's
Yeah. Yeah, we've been using it for, I don't know, 4 or 5 months maybe. There are certain advantages to that company. They're a fairly new company here, and they can, brand the packaging for you. They also make a monitor that comes with it. They'll give you a little discount on the monitor if you get an appliance. So there are certain advantages to using that company, and we're going to be looking at it even more. Um, they can drop ship appliances to your patients too. So there's a lot of things that different manufacturers do that we like to take advantage of. So that's at least with that company, they can do that for you.
Yeah, you mentioned a monitor. What is that? What is it monitoring?
Well, it's a diagnostic monitor. It's much like the Check Me 2. It's their own version of it. Um, it can be used for diagnostic and also for monitoring efficacy and compliance afterwards.
What about you, Dr. Shah? Do you have experience with the Hush Vera?
No, I mean, I think Panthera makes a very similar device,
Mhm.
and I've had good experience with Panthera and their team there. Um, so I haven't tried their device specifically. I would
Okay.
in terms of those looking for nylon, for dentists looking for nylon devices, also consider the Serena Sleep Elevate.
Mhm.
Is has been a really nice device for me and patients, especially their new, or I don't know if it's, you can call it new now, but they have a 4 millimeter L block is what they call it, where the top and bottom tray can interlock with each other, so you can
Mhm.
slide laterally, but the patient can't open, which is really works out nice. It's very slim. There's no hardware on the side, and I believe I it was I was the one who gave them the idea of doing it that way, that design. So I'm trying to get them to change the name to the Elevate Shaw, but I
Yeah.
can't. Or some. If you guys can give me some ideas, but I can't seem to
What
get them
about
to do
like
that. So
we could do like a portmanteau, like Shalivate.
oh, there we go. That
Shockwave.
works.
Yeah. Yeah.
But it's a really nice device for those who haven't tried it.
Got it. Kent, you mentioned Prosomnus earlier, and they've got, their proprietary materials. Uh, JT, you mentioned some of those herbs materials. Dr. Shah, you just mentioned the nylon materials. Why would you use one versus another? Is it preference? Is it durability? It fit?
I
What
think
are the
you said it
factors that you're
earlier.
considering there?
I think patient, that's number one. Um, you look at the patient, your evaluation, you talk to the patient, you see what their needs are, and then, medical needs are as well. And based on their anatomy or level of bruxing and other things, their coronal height or the height of the teeth as well, and if they kind of sufficient undercuts or not, is retention going to be an issue? Those kinds of things. These are all the factors that I'm sure all of us look at. Amount of space in the oral cavity. So you're looking at all these things, and I everyone might do it a little bit differently. I never choose for the patient, but I'll give them kind of pros and cons of each and let them decide what they feel might be most comfortable for them.
Is that how each of you guys do it in your practices as well?
I do
JT,
not.
you're shaking your head no. Tell me more
No,
about that.
I pretty much decide for the patient. I used to do the throw the multiple appliances out on the consultation desk and review pros and cons, and I found that patients would be confused. Um, so we show them a device that we use since I have sleep apnea. I developed a pretty cool video that educates the patients. Basically, it's informed consent on an iPad. And so it walks them through all the steps and talks about my journey with my sleep apnea. And it shows my device, my Dream Systems Herbst. So that works for me. Um, the fit's impeccable. The durability is there. Low volume, not as low volume as an EMA. We want things that obviously maximize oral cavity volume. So that works for me, and it fits my criteria of having the ability to have lateral and protrusive, to have the tongue get up and out of the airway, which is the way Inspire works, hypoglossal nerve stimulation. So that's what I push them towards. I have very few patients that push back on that design. So that's what we deliver, I'd say probably 98% of the time. And then my
Okay.
go-to would be an EMA for the patients, like I said before.
Okay. And what about yourself, Kent, as far as is that process in your office? What does that look like?
Yeah, I'm gonna fall somewhere between John and Srujal here because well,
So diplomatic.
no, this is true. I developed a philosophy many years ago when I was about 4 years old. When my mother she didn't believe in just one option. She always gave me two. She would say, Ken, you want to take a bath? You want to brush your teeth? I was going to have to do both at some point, but I had to choose one of those, right? So I've carried that philosophy all the way through. And so we always give patients two choices because we found that if they make a decision, they're more likely to wear it and less likely to complain about the decision they made. But if you just give them one, it's more dictatorial. I just don't think that's the way to go, but that's just our own philosophy. So almost every time there will be two different appliances that would work for a specific patient. Sometimes 12 will work for them, but there's always two. And so maybe our two favorite at that time, and obviously insurance dictates it too. Like John, we're all insurance based. There's no question about that. And sometimes it requires a PDAC appliance like a Herbst or the Panthera. I hadn't mentioned Panthera, but it is PDAC approved for our Medicare patients. Another nylon appliance. So sometimes it's the Panthera and the Herbst,
Mhm.
so we'll let them make the decision. So anyway, that's our philosophy.
Got it. Got it. Yeah, I mean, it's I think your mother was a wise woman with that illusion of choice.
Yeah, right.
So let me give you we're going to play one of these word association games, but we're going to do it with appliances. I'm going to give you a presentation and tell me what device or devices come to mind for you real world in your practice. So Shrujal, I mean, the bruxer, cuss tips, everything flattened, lateral bruxer. What devices do you sort of default to as far as best indicated for them? Of course, you're going to let them decide, but what are the three or four that you might set out for them and explain to them in that situation?
Yeah, no, Herbst Advanced, Herbst Elite, from Somnamid, really, really good product. It just drops it almost every time. So
Mhm.
that's what I'd go with. Surprisingly, if the patients, if their teeth are not too worn out, they have sufficient undercuts. The nylon devices, the Serena device would do hold up nicely as well, because it allows for full lateral movement. So
Mhm.
that would also be another one I might consider.
Gotcha. JT, I think I know your answer here based on your
Herb,
previous one, but
Herbst,
let us
Herbst.
hear it. All
Yeah,
right, all right.
yeah.
And Ken, what about patient? Maybe 4 to 6 teeth on each arch. What device are you going with there?
It's called an APAP machine. I don't know if you've heard of those, but
Got it.
I mean, 4 teeth in an arch is a little bit tricky. I mean, I've broken teeth with appliances, and I've done just about every bad thing you can think of over the years, and I have to be a little more careful with that. The bigger we get, the more careful we have to be with lawsuits. You don't want to do too much there and take too many chances. But it's not that we won't make something with 4 teeth, but pretty much that's why we offer PAP therapy in our office, because we have that option. But yeah, if they've got six, yeah, we're more likely to suggest an appliance, and there's really not one that works any better than the other, I don't think. We'll use the Oasis if we've got somebody with an upper edentulous arch, and they've
Mhm.
got lower teeth, 6 to 8 or whatever.
Mhm.
But yeah,
Okay. What about Shrujal? What about patient with just very little undercut? Maybe the soft liner possibly not indicated for a patient like that for retention because due to retention or lack of retention. What device are you going with there?
Not a lot of undercuts, right?
Yeah.
The soft liners actually is what, I don't know if that's what you were saying, but it actually work out the best in my opinion for in those cases. They really hold on, help to maintain retention on the teeth. I feel like the best. Perhaps some ProSomnus devices, if they can really get in there with the acrylic or something. I'm not sure, but in those cases, currently I just go to something with a soft liner like the Herbst or the Flex or something, the Fusion.
Got it. What about and I'll throw this up for each of you guys. It's a question that just came through. PDAC approved device, patient has a nickel allergy.
Panthera.
Yeah.
Yeah, we've got a consensus there. That's a rarity. I
Yeah.
feel like we should just shut it down now for the rest of the night.
It's the only, what else is there?
Yeah, that's it.
Yeah. Didn't
Well,
have,
Silent Night,
yeah, yeah.
is it Silent Night PDAC approved? So you could go that route.
And I wouldn't.
But yeah, I wouldn't. I've had some big issues with the fitting of Silent
Yeah,
Night
I was going to
devices. I don't
say,
know if you,
I thought we're talking about appliances that work.
Yeah. Oi.
Oh, sorry. Did I really say that? Yeah, sorry.
Is so Silent Night, we've talked in some previous webinars about direct to consumer business models from companies like is it Daybreak. they market the Silent Night in a lot of their advertising. Do you guys know much about that? Is that the only device they use, or how does that
That's as far as I
unit
Yes.
work?
know, but I don't know everything.
Ken, I agree. I just had a patient come in that had done that. Actually, he's a cardiologist, and I was pretty shocked that he did that. And I wanted to ask him if he would do his pacemaker the same way, because that's pretty much what you're looking at, right?
That's
The fit was pretty horrific. A lot of joint pain. So that direct to consumer model to me, I think is just going to make things way better for all of us that do it the right way.
yeah, but they bill medical insurance for it, and then they can't get accustomed when they
Correct.
don't like Silent Night.
Correct. And then he realized that he had to pay out of pocket, but he also realized that he'd made a huge mistake once he saw what we actually did and how valid our treatment was.
Mm.
So it's kind of like this Smile Direct deal as well, that has been
Same
fought
thing.
for a long time, right? So I think sooner or later the consumers will figure it out.
Mm. Mm. Anything you want to add to that, Kent?
No, we have patients it was either yesterday or this morning, I can't remember. Another daybreak patient told us that, well, I just think I'll try the daybreak model first. And I think my team was able to talk him out of it, but I'm not sure.
Mm. Okay. Srujal, what about patients with veneers, anterior veneers? Do you have a go-to?
Ooh, good question. You can go with probably a lot of devices here, including, even prosomnus. Soft liners are also great with the Somnima devices. Panthera makes a great, facial or buccal strap only device that has no coverage on the veneers, which I really like. So you just don't even touch them, and I like that option. As long as you have good retention, then that works out quite nicely for me and my patients.
Got it. Kent, are you using an Evo for most of those patients with veneers?
I'm not really that concerned about any device with veneers.
Mm.
Yeah, if you do a soft liner, the only problem with veneers, they don't create a lot of undercuts, and the nylon appliances aren't as retentive with no, they need a little bit of undercut, and it's more difficult with a nylon. They can create, if you need them to, they can create little interproximal extensions to help with
Mhm.
that, fiber or nylon. But
Mhm.
in general, I don't like to do that unless there's pretty good retention. But I don't shy away from any appliance with veneers.
Uh, JT, remember Respire and Whole U? They were acquired by Dynaflex,
Yes, sir.
and Dynaflex still offers the Respire Blue device. There are a
Hmm.
couple of other labs. There's one that has a license to manufacture it called Crane Dental Lab in upstate New York. But can you there's a specific question that came through about the Respire
Sure.
Blue. Can you just talk a little bit about I know you've used it in the past. Can you talk a little bit about your experiences with it?
Yeah,
When would you use
I
it? When wouldn't you? What'd you like about it? What didn't you?
so I had great success with them. Um, David Walton is a great personal friend of mine. Spent a lot of time with David. I learned a lot from David. David's brilliant and knows a tremendous amount about appliance design and forces that are exerted on the jaw and the teeth,
British
etc.
accent sure goes far.
It does. Give the dude a break. Um,
He's just like, oh, I'm hungry. And it's like, oh, God, the guy's brilliant.
anyway, um, when that company was changed hands, I had problems with fit and finish.
Mm.
So, and then there were problems with that appliance being dropped and not being PDAC approved. So I no longer use those. But in the past, I did have very good success with them when David was running it.
Got it. You guys want to add anything to that? Your experiences with the Respire Blue device? Again, it was a specific question that was submitted by somebody that's on tonight.
Same experience.
Okay.
Yeah, it's been a while since we used them. They were too bulky for us anyway. You talked about an appliance that somebody's going to wear is the best one, and so I appreciate that every manufacturer is trying to get smaller and smaller and smaller, and I'm always going to be a fan of that.
Got it. Let's do this. Let's talk a little bit about combination therapy. And I'm talking about an oral appliance and PAP in this situation. How often, Kent, do you use that in your practice? And when, why, what are the considerations for Joe and Jill, dentists that are on tonight?
I mean, when you have an HI of 114, I mean, you're not going to make an appliance for them, right? But sometimes we do an average of about 60 combination therapies a month, which is a CPAP and an appliance. And the patients appreciate that. We'll typically just give them the CPAP because, and sometimes we'll bill for it, but normally we just give them one and then bill insurance for the appliance. That's the way we work it. And that gives them both. They can use the appliance to travel if they want. Don't have to take the PAP with them. But honestly, if their AHI is really high, we have a lot of them that use both of them together. And it's interesting. We just had a patient the last week. I got the report that their appliance broke and they were not happy wearing just the CPAP. It wasn't doing the job. So they wanted to get another appliance as quick as possible.
Hmm.
So I just don't think very many sleep dentists do combination therapy like should be done. I think it's a very important thing that everyone should do when possible.
Srujal, do you use combination therapy in your practice?
Yeah. We have our very specific protocol of follow up with the patients and referring them back to their diagnosing sleep physicians for a follow up sleep study. And if that study shows any residual OSA that needs to be treated, then we recommend combination therapy if we can't do anything better for the patient. So it certainly works. I think it should be talked about more, and it can give the patient some options there that sometimes and oftentimes they don't consider.
Got it. JT, you're nodding affirmatively.
Yeah, I think that combination therapy is often forgotten and overlooked. In comments I've heard from other people that do sleep dentistry, well, I'm not even going to talk about that because the reason that the patients in my office is because they're CPAP intolerant. So I think if you take the time to explain to someone, like, Kent said, HI of 140, I've seen in the 120s, and I think you're delusional if you think your appliance is going to solve that airway issue. So if you have a rational discussion and explain things to the patient and help them understand what's going on with their airway and that they need more than one therapy, and the analogy I use is many people take more than one blood pressure medication. So there is not all one end all be all antihypertensive, and they seem to grasp that concept. So I think we need to it's the way it's presented to the patient.
Got it.
Yeah,
Let
of course.
me
Then you have an anesthesiologist that came in today with an AHI 5.6. He said, I've done my research. I want CPAP. So
Go
that's what
for
he
it.
got.
Go for it.
Yeah.
That's what he got. Yeah,
Right.
Yeah.
those.
So, you've all heard me say my biggest thing is to treat the patient's chief complaint. And I think so many people lose focus of that. And I've said thousands of times, and you've heard me say it, I've never had a patient come to me with a chief complaint that they want their AHI to be below 5. I mean, I've been doing this
Sure.
for 25 years. Never once have I had a patient say that.
Nope.
So treat the chief complaint. Kent, I'm 100% in agreement with you. If you want CPAP, go for it. I don't bash CPAP. It's a great system to control a sleep-related breathing issue for those people that can handle it.
Yeah. I'm going to pause there for a moment. And we're going to leave you out of this conversation, JT, because you're not coming to Scottsdale in January.
Sorry. I have a good
Rugel's going
excuse.
to be there. Kent's going to be there. I'm going to be there, but no JT. Why no JT? Because it's his birthday. And he's going to be a big one.
70.
Big 660.
60 plus 10.
Yeah. Yeah. So JT, you'll be missed, but
Thank you.
we've
I will miss
got,
you guys.
yeah, minus JT, we've got a veritable who's who. The 2026 Transform Dental Sleep Symposium, January 30th and 31st. Everything from practice management, business growth to insomnia and CBTI and everything in between. But the emphasis is on practical information. And we've got just a few topics here that we can show you. Well, yes. Yeah. So everything from we've got Brandon Woltman, who works for Star Sleep and Wellness with Dr. Smith, Angela Kowaleski, who works with Go to Sleep, and Ben Sutter with Sleep Better Austin. So, three of the busiest dental sleep practices in the country. Their marketing, their physician liaisons are going to be talking about what they do, where the rubber meets the road, about what they do to drive physician referrals. This is the panel discussion. Aaron Elliott, gadgets, gummies, and ganja. More and more patients are coming in with their devices, not their oral appliances, but their gadgets, their fitness trackers, with preconceived notions about their sleep. What does this actually mean in the practice? Jameson Spencer with What You Don't Know About TMD Will Hurt You. Last year, he presented about PRF, was the most lauded presentation of a weekend of really touted presentation. So we're really focusing on actionable information that it's a cliche, but that you can take back Monday and start putting it into practice. And I will guarantee you this: you take just 10% of what you learn at this meeting and put it into action, you will have a more successful, more voluminous, more efficient practice. We also were doing something a little different this year. The day before the meeting kicks off, so this is Thursday, January 29th, we've got 3 different workshops. Each of them are limited to only 35 attendees to guarantee an intimate learning environment to ensure that everybody gets what you need. The first of them is presented by the crew over at Pristine Medical Billing. Get paid, not played with medical billing. So Randy Kern and his team are going to take a deep dive, not on some sort of abstractions or some 101 medical billing stuff, but this is the stuff you really need to know. I mean, they're billing for dentists all across the country. Nobody is more attuned to what's going on than the crew at Pristine. So we've got that one. We've got the Pulse of OSA presented by the team at Prosomnus. We're going to talk a little bit about the future of sleep apnea treatment tonight. This is something I'm really excited for. They're going to unveil a new device meeting, and everyone that attends that workshop will get a sample of that device. Dr. Smith, Kent, you are presenting there. I was going to give you a break about presenting at 2026 TDS, and they pulled you in.
Yeah,
So I'm sorry, but I'm thrilled you're going to be there. It's going to be great. And then lastly, the team at Sleep Apnea Leads is going to present the sleep growth playbook. So they're going to focus on how to leverage your patients to get more referrals, to drive more physician referrals, and then also digitally how to use your site and pay-per-click ads to drive more patients to your practice. Not patients that don't have insurance, not patients that haven't had sleep tests, but qualified patients that you can appoint patients and help these patients in your office. So each of these workshops do require a separate registration. Each is required or limited to just 35 participants, and two of them are more than half sold out already. I won't tell you which two. Get registered for those, and prices for the symposium do go up on November 1st. So if you're going to come to the meeting, get signed up now and save a few bucks. Kent, this is going to be your third time there. Why? Why are you coming back? You got other stuff to do. Why do you keep coming back?
Well, there's several reasons. I wouldn't be bringing 30 people to your meeting if I didn't think it was worth it, right?
No.
I mean, we're bringing our nurse practitioners and physicians and our all our excuse me, our directors. I mean, I don't think you get a more well-rounded group talking about the business of sleep anywhere at any meeting. Yes, there's some clinical, and we all will need clinical, but if you really want to grow your practice, that's why we're going. We love getting new ideas.
Appreciate that. Thanks for coming again, and look forward to seeing two of the three of you there, and hopefully a bunch of you out there. So get registered, tdssymposium.com. And then let's dive back into the questions. We've got some more
Well,
coming in
Jason, I
here.
was just going to
Yes.
say, I was thinking as you showed that my business partner and I were just talking that that's the best dental sleep medicine conference that we've ever been to. So when Viral and I were talking about, he was saying, "Hey, I got to register." He was telling me, we got to register us for the conference. It's the best one we've ever been to." And I was like, "All right, well, that's good. We'll go."
Man, I really appreciate you sharing that. And I promise you this year we'll have more vegan options for you.
Vegetarian, not vegan.
Vegetarian.
Thank
Okay,
you.
vegetarian. Yes. Promise. Okay. Let's dive back in. There was this trend a couple years ago. I don't hear about it as often anymore, but it sounded something like this: to provide my patient with a PDAC approved device due to insurance requirements. I want to use a non-PDAC device, so I'm going to give the patient a snore hook or some sort of inexpensive device like that to satisfy that requirement, and then give them the device that I think they should have. And can you just sort of weigh in on, add some more color, some more flavor to that, please?
Well, yeah, I know that one of the tricks was to do the snore hook. I know at least one person that got in trouble for doing that with Medicare. Um, I'm not sure I'm very comfortable with that. I want to make a PDAC appliance that they could wear. So we'll give them a Herbst or a Panthera and then give them another one that they may like better. I just think that they're going to like us better. They're more likely to move forward with treatment if we offer two appliances, just like sometimes we'll offer an appliance and CPAP. So, like I said, two.
What about you guys? Your thoughts or experiences with that sort of
Yeah,
model machination?
I'm not going to play in that arena.
Yeah.
It's just not worth it. Um,
Yeah.
just do what's
We
right. And I don't think I don't like to play with concepts or ideas that push the limit. I'm busy enough doing the right thing, doing it the right way, and I'm just going to stick to that. I know it works. Don't have to worry about Medicare coming after me. I've been audited 3 times, never had an issue. So I'm going to stick with what I know that works.
Yeah, I
Got
would
it.
agree. I think Dr. Glassman was just sharing in the comments there as well that snore hook is not PDAC approved anymore. But and but besides that, and we offer all of our patients, if I feel like there's another device that could be better suited for them outside of their insurance, I share that with them. and it's their choice if they want to pay extra for that or not. However, now that we have, potentially 3 devices or 4 devices with the Panthera also and the SomnoMed Hertz devices that are PDAC approved, I mean, typically one of those is suitable for the patient. They're able to tolerate it, nicely and use it. So,
Got it. What about this is, sort of an umbrella term, I guess, as more devices or more companies have devices like this. But what about dorsal devices? What are the indications for use for a dorsal JT?
I don't use the
Well,
dorsals.
yeah,
Yeah,
that was
I
the
don't
wrong
use.
guy.
That's
Herbst,
sorry. I
Herbst,
mean,
Herbst.
I sound like a broken record, and I apologize for that, but I'm telling you the truth.
Yeah, no, I appreciate it.
I started a long, long time ago with Respire, tried dorsals. Um, there were some design problems. Agreed that they are bulky appliances back then, 25 years ago. We've progressed to where we are today with um, low volume appliances to maximize oral cavity volume. They did work. Um, they didn't have a lot of slop. There were problems with the fins breaking off. Then they reinforced them with metal. I lived all that. Thank
Yeah,
thank goodness I didn't have to have any patients go through a bronchoscopy because of aspiration of any of the parts. So, I mean, you think about, Kent, how long we've been doing this and where we first started and some of the appliance designs we've used and where we are today. Um, it's pretty amazing that our patients even had any type of positive response. I mean, look at the Clearway appliance, right? You want to talk about tooth movement? There's one. I always talked about that appliance as being the one that Hannibal Lecter would choose. So um, dorsals did do their thing in the day. I think that they've kind of, in my personal opinion, they're passe.
what would you guys add to that?
I mean, I use a lot of dorsals, but if we see worn cuspids and we know that they're a lateral grinder, we'll go with the Herbst or the EMA or the Panthera. That's what I mean. We've got all kinds of options, and I'm glad we have all these options because we need all of them. But typically we don't really have much problem. The material has improved dramatically. Yes, boy, I remember all those fins breaking. One particular style, I replaced all 60 of them that I made because I thought this is the greatest new appliance, and nope.
Yeah.
So yeah, those fins could be a problem, but they're pretty good these days.
what do you guys think
Uh,
for edentulous patients? Could that fusion or the dorsal device be beneficial for edentulous patients?
I use Herbst for edentulous patients. Yeah.
And you
the
guys ever
JT,
find that
you
some
said use it the Oasis, you said, for
No,
edentulous
if they
patients?
have lower teeth but no upper teeth, that's when I use
Yeah.
the Oasis. Yeah.
Okay.
From Dream Systems.
What were we saying, Shrujal?
oh well, and some patients like to have their devices as 2 separate trays. So if they need a device with a soft liner and they can put on one tray at a time, and it's easier for them to do that, then that could be an option for those patients. Some
Sure.
patients gravitate towards something. You might show them a few different options, whatever it is, 2 or 3 options, but then they just really are really take to the dorsal device. Then there you go. So
hmm hmm Uh, Shrujal, what about patient that's just finishing up ortho or just finished ortho and needs a device? Concerns about minimizing, eliminating the possibility of tooth movement,
yeah,
opening up contacts. I mean, what do you use in that situation?
um, prosomnus I think is a great option. Really locking everything in. I do offer that as a first option for those patients. EMA 3D that we 3D print in house
Mhm.
is also another good option there. You can do it with any soft liner device, like the Herbst or that. Just wrap the distal and do a soft liner on the inside. And then I've been really encouraging my patients to let me make for them retainers if they don't have them already. And then I encourage them to wear them, a few hours during the day. So if that's, I'd like to say maybe between dinner and sleep, put on your ortho retainers. That will really help things stay in place. And that has worked out really well.
Got it. I've got another question. What about patients with an anterior open bite or tongue thrust? What about, well, let's go with that. Anterior open bite, tongue thrust. Anyone?
I
The
think
one with herbs.
yeah, you wouldn't go with the L device from Serena. I can tell you that. So, most companies can give you an anterior opening. If they can't, then you go with a different company. And you just don't want to have anything like I wouldn't make a tap, for example, with a tongue thruster. They'll get a sore tongue. Just have to take those things into account. But anytime there's an anterior open bite, you have to worry about vertical because they're going to be pretty wide open if you get space in between the posteriors for acrylic or nylon or whatever. So the increased vertical would be my number one concern. So you got to minimize that as much as possible.
Yeah, I've seen
Okay.
patients with a tap that have actually had a bifid tongue. So
Yeah.
that was an interesting case.
Mm, got it. Uh, what about, so I mentioned, and this isn't a commercial. I want to assure everyone here we have no corporate sponsors. We've praised and thrown pretty much everyone under the bus tonight at some point in time, but mentioned that new ProSomnus device. And Kent, you mentioned with the Vera Hush that they've got some sort of a monitor too. What do we know about this? We've been hearing about monitoring devices or monitoring chips for years, and that this was really paramount to sort of be viewed by the medical world and the insurance world as being on par with app. It was sort of the missing link. I guess, first of all, is that really true? And then secondly, what are your views on this new device?
Are you asking me or throwing it
Sure.
open? Yeah.
Roll with it.
Well, yeah, because I've been wearing one of the beta devices, which are really no longer necessarily beta. Uh, it tracks O2, tracks sleep time you went to sleep, time you woke up, or the wearing of the appliance. But right now it's not FDA cleared, right? So they can't call it a medical device. They're calling it a wellness device. And I like the data. I like the portal. It's fascinating. It gives you a sleep score. Your goal is to get 100. And so I find it interesting. I do all I can to get 100. So I know that if I don't get enough hours of sleep, I'm not going to get 100. I'm very competitive.
It's
So
gamified. Yeah.
it forces me to get enough sleep in addition to make sure I'm adjusted correctly because the O2 needs to be good as well. So I don't know exactly when it's going to be FDA cleared because not until that time can we bill medical insurance for it. And I don't know what the cost is going to be yet when it's FDA cleared. So we'll see. But I think there's some promise. The advantage is you know that they're wearing it, right? So like for the DOT, you can tell the doctors that we show not only efficacy, but we can show compliance now. Because your alternative is to put an appliance in and have them take home a monitor.
Mhm.
And that doesn't necessarily show compliance. So I don't know. I think the future is good, and I'm sure there's going to be some competitors out there that do the same thing. ProSomnus is the only one I know of at this time that's putting it inside the appliance.
Ken, you're talking about the hushed Avera?
No, 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 no.
No, the ProSomnus.
The Hush Vera is not within the appliance. They give you
That's
a
what I was wondering.
separate
Okay.
monitor, right?
Yeah.
They offer a separate monitor. They'll give you a discount on that if you get one of their appliances. That's what I was trying
Got
to.
it.
I might have been
Got it.
confusing.
No, sorry, that yeah, my confusion. Yeah, I'm looking forward. I know there's been some issues with the like getting the different sensors and compliance chips out there in the devices that were available and then not available, and batteries were hard to replace and data was hard to download and things like that. I've been waiting for a while now, as I'm sure many of you have, for SomnoMed's Rest Assure device to have the compliance chip data and the other data that it's going to give, like a surrogate AHI. So it can also, once it's approved, measure kind of AHI from extrapolated data like jaw movements and things like that. But I think their compliance data, their compliance chip is going to be available next year, from my understanding. So their Rest Assured, it'll be the Rest Assured device, but it's only FDA approved for compliance monitoring right now, is what I've heard. So I think that once that becomes available, we'll use it a little bit more. And then the other stuff, which we're most excited about, hopefully will come soon after.
That's new to me, because the last time I talked to the CEO or co-CEO of SomnoMed, she said she was putting that on pause. They had more important concerns but maybe it's rolled back in and they're going with it now. I don't know.
Yeah, I think that's changed. Most recently.
Well, good. There needs to be more out there. I'm glad.
Yeah.
Yeah. Competition is good. Yeah.
Yep.
Yeah.
So
Unless it's for a Herbst. That's it.
So you didn't even
No.
need to have me on, just have me say herps, herps, herps. I have a question about this technology. So I've used DentiTrack since its inception. Don Bradley's a close personal friend and played with that a lot. Does anybody have concerns? There's compliance with CPAP, correct?
Yeah.
For the patient.
Yeah.
If the patient isn't compliant with the CPAP, what happens? The CPAP's taken away and it's repurposed, and it goes, if I can't wear it, it's repurposed and it goes to you, Kent, right?
If it's Medicare, right.
What happens if there are the same compliance issues placed on oral appliances? You can't take my appliance and give it to Kent, and now we're not paid for it. Anybody have any concerns about that?
Yeah, I think that's a concern. It could always happen. I think that's a little bit of a scare tactic, but I get it. It could happen. Hopefully not. But again, that's just Medicare right now.
Right.
So we'll see.
Yeah.
Srujal, how would you weigh in there?
I think anyone with hopefully any kind of common sense, like in terms of the insurance bodies and regulatory bodies, would know that these custom-made devices can't be returned or discounted, or once it's made, it's made. And, if they're not going to be using the device, then there's nothing we can do as providers. Hopefully they're aware of that. And it's more of a matter of, for patient benefit, we want to make sure that patients are compliant with therapy and they're getting the appropriate therapy at the right time. And so if they can't use an oral appliance right now, then somebody is there to help them switch to something else that they can use, or, like we've talked about earlier, go into combination therapy.
What other device innovations are on the horizon? You all are really well connected in the industry. What other innovations, whether it's device styles, materials, or things like monitoring, are you privy to that you can kind of share a little bit about?
Monitoring is about the only thing I know of on the horizon. Unless you want to talk about the Evo guided, which is now lingualess. I like that. Again, what John has mentioned, you want maximum oral volume, and really what we're talking about is maximum tongue volume. And the Evo guided helps provide that. And that is the only one that they're putting the monitor in. The HWO2, they call that.
Okay. Got it.
I've now done, in the last month, 2 of the Oasis Ortho combination devices. So patients will come in and do like Invisalign or Candid therapy or whatever with us, and then we'll make him an Oasis appliance that fits over that. That
Mhm.
has worked out surprisingly well. I mean, those just snap in over the first set of the patient's, aligners, and then supposedly they're going to fit throughout the treatment. And I've been impressed with what they can do.
Very cool. And
Um,
what sort of period of time like had you had a patient in that device?
no, I mean, I've just started two of them
Just recently.
in the last like 6 weeks or so. It's
Oh,
Oasis or Dream Systems, right, John?
Yes.
That's who you use? So
Yeah.
yeah, I've been really pleased with that product and their customer service and kind of guiding me through that process. It's been pretty amazing. So you have to submit a lot of information, if you will, for them to do it right. And I think that's the only thing is the scans. You also have to take a physical bite registration, which you have to mail in. So there's a physical mailing product, plus you have to scan and email those scans, and then you have to physically, I believe, mail in the first and final orthodontic aligner trays. So let's say a patient has 15 series, you have to send in the first and then the 15th set, and then you have to send in the ClinCheck, like Invisalign STL files for the first and the final aligners. So it's a little bit involved, but the results have been great in that they just snap right in, and the patients have been able to tolerate it really well. So we'll see how it goes from here, but that was a surprise to me.
Yeah, Jim
gotcha.
Adiago does a great job with Dream Systems. And don't forget, Rob Weiss from SML was very instrumental in developing an appliance for clear aligners. So that would be another one I would look into.
Very cool. We're about out of time here. We've got a bunch more questions that came through. I just want to mention this real quick and we'll do a quick lightning round, blaze through a few of these questions, and we'll get everybody to dinner or bed, depending on which time zone you're in. Reminder, get signed up for Transform Dental Sleep. Here's a few more of the presentations we've got. Actually, Alicia wasn't slated to present, but I was at the Awaken to Sleep Pivot Masterclass a couple weeks ago, and I was harangued by dozens of attendees wanting to know why she wasn't on the speaking roster. So she's going to be there. So get registered. We've got 4 sleep physicians speaking. Again, uh, just a wide swath of topics, but all practical, actionable, useful information. And it is a blast. And we'll party in your memory, John Herbst Tucker.
Thank you.
Yes. So get registered at tdssymposium.com. Quick, we're just going to blaze through some of these questions real quick, and then before we do that, anyone that's got to go, you're welcome to take off. You will get your C certificate emailed to you in the next 48 hours. It will also have a link. This is for you, Dr. Brewer. It will have a link to the replay, so you can watch this. Circle back, check out anything that you missed or you want to revisit, share it with your team, what have you. Um, you'll get that in the next 48 hours and register at tdssymposium.com. Okay, a couple things real quick. And this is for anyone, but I need you guys to jump in because you've got to go, they've got to go. Um, are these types of tracking features more of a luxury, a feature only available in certain devices, such as the ProSoundness Evo Guided? I guess I guess other than sort of your own interest in the patient's, the efficacy of the device or their compliance, you know, is it on the horizon that this will be required by insurance, that there will be codes for monitoring? Um, or is this just sort of a novelty for nerds like you guys?
I certainly hope it's not required by insurance. because what if the insurance company wants a refund for the appliance you made because they determined that it didn't provide adequate treatment?
Mhm.
So that's one thing. The other thing is there are people that have orthosomnia. They're obsessed with their sleep. Sometimes they think technology can be bad, and they're so focused on a number at the end of the night, whether it's an Aura ring, whether it's a Whoop or your Apple Watch. So sometimes I think that technology can be good and bad.
Okay.
Yeah, in 2011, we didn't think we would ever be restricted from Medicare from doing specific kind of appliances, but that changed. So I wouldn't put it past insurance or Medicare to do anything.
Correct.
Okay. Uh, Kent, I think you're probably the most familiar with this. What does the ProSomnus device that's coming out at TDS, the hard launch there, what channels does it measure? And namely, how does it measure efficacy?
Well, yeah, compliance it measures, but as far as efficacy, it measures, it's going to be, the HI is going to be extrapolated. They can't do that now because it's not FDA cleared, not a medical device. It's FDA cleared as a wellness device. So right now it measures O2, saturation, T90, as well as sleep time
Mm.
or wear time. And then from that, they extrapolate a score. But there is information inside that once it's FDA cleared as a medical device, it will provide us more data, but that's all it does right now. And maybe, I'm sure at TDS, we'll be revealing everything that it will include.
Excellent. What about da-da-da-da, thanks for the lecture, blah 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 blah. All right, guys. Oh, Suchi Anderson wants to know what is your guys' familiarity with the ApnoDent device? Experience with that?
I do not.
Not not heard
No.
of that. Yeah.
But
No.
somebody mentioned the NOAA. I think that's an intriguing design from
Yeah.
Spain. I
Yeah.
like that, and I'm going to be trying some of those. And then there's the Airvata, AIRVATA, that's a new company out as well, new nylon
Yeah.
appliance. So I love when companies keep coming up with new appliances, and the same companies come up with improvements.
Yes. What about guys? What about uh, provisional devices like I don't want to get in trouble here for referring to it as provisional, but I'll just say like a My Tap or something like that. Experience with those, and how do you use it? Why do you use it? When do you use it?
Well, okay, I don't want to keep answering the questions, but yeah, we use the Blue Pro. That was our favorite. We've used the MyTap before. Avera is coming out. They have a temp appliance they're coming out with. So there are some good ones out there now. And I think more companies will be developing those. But we don't use them very often at this point.
Yeah,
I
same.
think that I think the days since we're scanning now more than we ever were in the past, I can have an appliance made very, very quickly. And I was using them for the patient that their dog ate their appliance, and you want to see a patient panic and tell them that it's going to be 3 weeks for them to get a new appliance because their dog ate it. They're not very happy. So
Yeah.
that's when I would use a transitional like the MyTap. But since we scan, we've got the models and you can pretty much have a device turned around very, very quickly. So I'm not sure that the transitional is that important anymore, unless you're doing a full mouth rehab and trying to stabilize the patient for that. But I also tell the patient, why don't you just go on CPAP till we're done?
Got it. Srujal, You've
No,
got
just
oh,
but
go ahead. Go ahead. No, please.
I was going to say I think it's Pure Sleep. We like to use the Pure Sleep temp devices and they work well. Low cost for both us and the patients. And if, like Dr. Tucker said, in those situations, sometimes it's useful, so we'll use them.
Srujal, we're going to wrap up here. You've got, you've treated a zillion patients over the years. You've been immersed in dental sleep medicine for some time. You've got one piece of information you can impart to everybody tonight. Little fortune cookie pearl. What is it?
Oh man, that's tough. Um, I especially probably for newer providers, I leaned so much when I first got started 15 years ago to people like Kent and Dr. Glassman and others, and I think just attending these conferences and asking a lot of questions and being curious to always learn. I think that's the best thing that you can do. It's the best service you can provide for your patients. So I don't know. I don't really have anything else, but that has helped me. So that's what we do.
Commitment to continual learning. JT, I'm going to ask you the same question, but I know your answer is simply Herbst.
No,
No,
my my answer is don't treat every patient.
not everybody's a candidate.
Not everybody's a candidate. You have a 430-pound individual that's not motivated to get better. My appliance, Kent's appliance, Dr. Shaw's appliance, JT, your appliance, that's not going to help them. They've got to want to help themselves. I call it the 90-10 rule. 90% of the onus is on them to want to get better. If they don't want to get better, I'm not going to get caught in that trap that they come back and say, your appliance that you made me doesn't work. So learn something from that. Don't treat every patient.
Kent?
Yeah, he meant don't treat every patient with an appliance. But I think every
Correct.
patient should be treated if they have sleep apnea. Yeah. As far as appliances, yeah, just learn different styles. Because again, you're not going to fix every patient with the same appliance. So I think it's very important that you become familiar at least with two different companies, if not more than that, especially if you file insurance and you've got to use those PDAC appliances. There are some successful dentists that do fee for service. They don't use insurance at all, and they have much more freedom than we have. But I would suggest if you want to grow your sleep practice, you need to use medical insurance if you want to do much with it. And therefore, you have to learn different appliances.
Well, Srujal, JT, Kent, thank you so much. And I mean, your time is invaluable. Your experience is invaluable. And I appreciate you sharing so openly, so freely with everybody tonight. Really appreciate it. JT, happy early birthday.
Thank you, sir. Thanks for
This
the
is,
opportunity.
yes, and this is our last webinar of the year.
Mm.
We've got some health matters to tend to, which means we're going to kind of go dark with webinars for some time. So I hope to see you all in Scottsdale. Go to tdssymposium.com. Most importantly, if whether you can't make it or you got a birthday like JT and you're not going to be there, but most importantly, take what you learned tonight and, like Shrujal said, keep learning. That commitment to learning, to growing is paramount, and then put it into practice. Right? Treat patients, treat your team members, treat their spouses. Get moving, get going, and get that flywheel turning. And you can really make an impact in your community. And by doing that, you've changed the world. So just make it happen. And thank you again, JT, Shrujal, Kent, all of you. Thanks for being here. Your commitment is greatly appreciated. Have a great evening, and hope to see you soon. Take care,
Thank
Thank
you,
you.
everybody.
Jason.
Thanks, Jason.
Be well.
Thanks,
Thank you.
guys. Mwah.